afternoon. My name is Brandon Braswell with Liberty University for Psych 491 Capstone in Psychology under Professor Cynthia Crumry. Today's date is Tuesday, June 25th. I chose to interview Miss Laura Crawford. She is a licensed social worker and the CEO of Advanced Practice Mental Health and Wellness. I chose to interview Miss Laura Crawford because of her extensive knowledge in the field, as well as an expressed desire to help and treat patients in the local area. Now, when I asked Miss Laura what, or for her to describe her duties as a counselor, she told me that her duties include diagnosing, assessing, and utilizing techniques and treatment plans to help individuals. She also told me that she helps individuals evaluate their life situations and make changes in their life and to better balance it and create a better mental space for themselves. Now, Miss Laura was extremely devoted and ecstatic when I asked her about the fulfillment that she gets from her job. Some of the things that she said that really stood out to me were that she enjoys watching someone leave her office after having learned to love themselves. She said a lot of people come into her office and they are essentially at rock bottom. And when they come in, they're broken people and they don't know how to love, they don't know how to feel. And she said after working with them over the span of weeks or months or even years sometimes, they eventually will walk out of her door a completely changed person. They know how to love themselves and how to love others. And she said watching them make that turnaround is what really keeps her focused and gives her that job fulfillment that she's searching for. One of the other things that she said was she loves to see parents learn how to love their own children. She said it can be difficult for parents who are dealing with children who have various diagnoses and conditions, and watching them learn how to reparent a child who's been diagnosed with a disability or otherwise is another really fulfilling part of her job, just to watch these families come together. One of the other things that she said was she really enjoys being a champion for change. She loves watching these people make changes in their lives for the better and watching them stand up and become exemplary human beings thanks to her help and, of course, ultimately their own. That was one of the things that she mentioned was, and we'll get in more detail on that later, but she mentioned that you can't really get help unless you want help. Which leads me into my next portion, which was I asked Miss Laura what some of the most challenging parts of her job were. And it was really disheartening to hear her say that the most challenging part of her job is working with children. Um, at first, I didn't fully understand what she meant by that, but after she went into some explanation about her past and the history she had with some children, she said it can be extremely difficult when you have a child sitting in front of you who's explaining a variety of abuses and sexual assault and various things that they've experienced at the hands of their own parents and their own family members. And she said it's difficult. It's extremely difficult when you start to realize what people are capable of, especially the ones that you think are the closest to you, and having to help treat the perpetrators of these crimes and these horrible events. She says it's extremely difficult part, and she doesn't enjoy that part of her career. Some of the other things that she said were challenging was staying in her own lane. She mentioned that she came into the career thinking that she could help anybody and everybody, and part of the challenges that she's faced is having to swallow the pill that she's not capable of helping everybody. And at the end of the day, they have to want treatment, they have to want help, and they have to want change. And if they don't want those things, then she ultimately can't help them. And sometimes counselors, social workers, psychologists, therapists are not always the right fit for every individual. And you have to be willing to accept that of yourself. And maybe they need to be seen by somebody else, or maybe they aren't ready to change. But either way, she said that was one of the challenging parts of her job was trying to remind herself that she can't help everybody. Now I asked Laura what she was doing for continued growth in the field. And she said that she's delving in more deeply into cognitive behavioral therapies. She said she did not have a lot of experience with it and only got some experience through her bachelor's degree program. However, she also is utilizing that CBT training and collaborative care with other physicians in her practice. She said that she understands that she's not a the expert on everything, and sometimes she needs help and has to lean on other physicians and other clinicians to help her make a determination on certain diagnoses and certain treatment plans. Um, so alongside that, um, she said that she was exploring other methods of training but hadn't decided what else to seek at this point. She had no desire to seek a doctorate level program. She was content doing what she wanted to do. Like I said, she's a CEO, and she really wants to continue helping patients while she also grows her own business. Now, what I thought was admirable about her was that she said she will never place value of money over the well being of her patients. She said she will continue to grow the business and expand the business. In fact, she has opened 4 new practices in the span of a couple of months. However, she has since stopped expanding because she was concerned that by exploding the business and as fast as it was growing, that she would not be able to continue to see patients on her own. And that is not something she wanted. She wants to continue seeing patients and continue making those personal connections with them. And she said that she will always put the patients first over money, and she would rather have the business go negative than send the patients out the door without treatment simply because they couldn't afford to pay. So I thought that was extremely admirable, and she's a huge motivator for me. Um, so I followed that up by asking her which recommendations would she have for somebody seeking employment in the field. This one was an interesting question for her. She had quite a few things to say about different degree programs that she wouldn't recommend. However, the things that stood out to me the most was she said to make sure that you make your own mental health a priority. She made it clear that if you don't take care of yourself, then you can't help other people. And in this career, you're embodying the problems of other people, and that can be really high stress and it can cause a lot of mental health issues. And if you want to avoid that burnout and continue treating patients, then you need to seek therapy of your own, including her. She seeks therapy of her own, she seeks her own counseling, and that helps her keep a steady mind on what's going on. She said, don't be afraid to terminate a client or a patient simply because you think you can help them. Like I said, and like she said, not everybody can be treated. Some people just don't want to be treated. Some people have really self-destructive tendencies, and it's okay to let them go. It's okay to say, I can't help you. So I thought that was very interesting as a recommendation because, um, I always assumed that we were trying to help everybody, no matter what. And she made it clear that you can't help everybody, and sometimes you just have to let them go, and hope that they'll make those changes for themselves someday. Um, she said you have to can the ego. That's a quote from her. Um, she said, leave your ego at the door. Don't let people get under your skin. Um, again, this all leans back to you can't help everybody. So yeah, I mean that's really interesting that she's really thinking that you can't help everybody. You got to remember that. She made that very clear throughout the interview. My interview with her lasted for about 45 minutes. We went over quite a lot. She had a lot to say, and unfortunately, I won't be able to cover all of it in this video. I wish I could, because she's very passionate about her job, and I can't wait to learn more from her. And I look forward to talking to her in the future and guidance for my own career path. Um, but otherwise, my time is up for this video. So, like I said, my name is Brandon. This is Liberty University in psychology, the capstone of psychology, Psychology 491, under Professor Cynthia Crumry. Today's date is June 25th, and thank you. Have a good day.